Hello everyone, my name is Dr. Aditya Gupta. I did my undergraduation and post-graduation in pediatrics from AIIMS New Delhi. I'm a DM resident in pediatric oncology again from AIIMS New Delhi. In this video, we'll be talking about this book. I've emphasized upon this book a lot previously as well. Now, since the NEET PG date has been officially been announced as March 12th, and you have exactly 2 months to, not even 2 months, slightly less than 2 months to cover your entire syllabus. I just wanted to strategize you so that you can improve your rank and boost your score. So I wanted to emphasize upon this book, First Aid for the USMLE, Step 1, 2006. This is my edition. I gave exam back in 2018. So I used the 2016 one. And how you can use this book in order to improve your score. So before that, I'll emphasize why this book is important. You have to realize that irrespective of how many concepts that you form, irrespective of how much efforts that you put in throughout your MBBS, for that matter of fact, you were excellent in your first and second final year, and you probably have been the university topper, or someone who has always excelled and gotten probably the distinction in each and every subject. INI, CET and NEET, both of these exams always will boil down to a lot of memorization towards the end, especially because there will be a good number of questions that will not at all test. They will test your concepts, but those concepts also will be built upon some amount of memorization. So if you have not revised those concepts, if you have not revised those facts, if you have not done that revision in the last 10 days, your rank is bound to decrease. There's no doubt about that. And that's why every topper, anyone else, keeps on emphasizing why revising your notes is so important. So everything boils down to the ability to revise in the last 10 days. This ability obviously will differ from different individuals to another. Some people can revise faster, and obviously some people are just, by the virtue of their intelligence, more intelligent. But the ability to revise can be improved by making notes. This ability to revise can be improved by the year-on efforts that you have done. But everything will boil down to those 10 days. And that's why the 20th notebook concept is so popular, so that you have at least a notebook where you have written down everything that you keep on forgetting, why you keep on, that you need to revise before going to the exam, so that you can just sort of just vomit out the thing that you have in your mind. I'll give you the biggest example possible. Even as an MD in pediatrics, I still cannot, for the love of God, remember developmental milestones. I still get confused what happened at 2 years of age and what happens at 2.5 years of age, what happens at 1 year, not 1 and 2, so obviously the difference is quite stark, and I'm able to differentiate. But still, the point being that some things are so dependent upon memorization, no matter what concept there is, that you have to revise them just before giving the exam. And this function of memorization, your rank will become a function of this memorization and whether you're able to revise this or not. And that's why this book, USMLE for the First Aid, while though it seems like a book for USMLE, becomes really, really important as far as NEET PG or INI CET preparation is concerned. I got an all India rank of 1700 in my first attempt. So basically, even at that point of time, I had not prepared. I had a severe depressive episode which required hospitalization also, and I had essentially I had not studied for 2 months before the exam. Still, I was able to secure a 1700 rank, which shows that my intelligence, obviously, that my preparation throughout my MBBS, I was regular in my MBBS. My internship preparation before that was adequate. But in order to propel you to get that top rank, you need to maybe able to memorize just before the exam, and that's why first aid comes important. So you will have your own set of notes. If you have your own set of notes, great. But still, I'll ask you to use first aid. So how do you use first aid in order to improve your rank? So this is how. So you just, this is my Devesh Mishra, which I use from pathology. After you have read a topic from pathology, or the second year, first aid is for the first and the second years. It contains physiology, pharmacology, biochemistry, first years and second year subjects, except forensic medicine, obviously. You read a topic, any small topic, you read it 5 minutes on it. You solve the questions that are given at the end of the exam, the review book that you're using, or from your Ratta Maro or Prep Ki Chhadi app, whatever that you're using for that matter. So in those questions, you will find that, okay, this is the thing that is being tested again and again, and this is the previous year question, so I have to remember it. For example, if I was doing ALL, I saw previous year's question. I realized the questions that I keep on asking are, what are the markers, the CD markers of ALL, and what are the prognostic factors for ALL? So these are the two questions that are common, have been asked multiple times, and the staining for ALL. Suppose I did AML, then I realized that AML is all about the FAB classification. Fair enough. And some questions are specifically related to the, your acute promyelocytic leukemia. First aid has already given and is a sort of a ready-made notebook for you. It's already a ready-made 20th notebook for you. It has already given ALL, has given you all the concept in ALL, has given you the markers or the prognostic factors as well. The things which you think are missing, just add them. So I knew that the question that they're asking again and again is the good and the poor prognosis. So just good prognosis, hyperdiploidy and early pre-reset, poor prognosis, hypodiploidy and trisomy 4 pseudodiploidy. So these are the questions that they had asked. I put this extra information apart from that's already given in first aid there. Similarly, as far as AML is concerned, AML translocation 1517. This is asked multiple times. Put a small star mark. Okay, this is a previous year question. Put a Q. Arsenic trioxide is used to treat. This has been asked, so put it there. And I knew that FAB classification. You just wrote down the FAB classification, and that's about it. In this way, first aid is just 600 pages. 600 pages for your first and second year together, which will comprise 40 to 50% of your paper. You will be able to revise it. You will be able to do around 100 pages a day. So in just 5 days, towards the final 10-day revision or final 1-week revision, you will be able to revise the entire first and second prof ka syllabus. Final prof ki strategy I'll probably cover in some other video. But this is how you're going to use first aid in order to memorize those things which are always and always going to be a headache to memorize. Put them together in one consolidated area. Okay, use this. You will have everything of first and second prof along with psychiatry and biostats. First aid plus previous year questions, any concept that you had from grant test that you feel like adding or anything that you feel important. Make everything combined together into this one consolidated resource so that in the last 10 days, you just have to do this one book. I'll show you how this book was important. See, this is the concepts and pathology. This is one book. This is just pathology. This is the entire first aid. You're getting? You cannot revise this even in 1 day or 2 days when you are preparing for your exam in the last 10 days. You cannot revise this, but you have to revise. Then how do you do it? This thing will come to your rescue. You can revise this book in the last 5 days. Okay. You can revise this entire book in 5 days, and almost every question I can say will come from this book, especially first and second prof is concerned. Everything that's written here is extremely high yield as far as the entrance examination is concerned. And when you will be able to have this one single consolidated resource, your first aid, whatever is given in first aid, along with the extra points that you might put. These extra points should be from your previous year questions, from your grant tests, and from whatever you feel will help you remember the concept better. So if you are able to do this, you will have the single consolidated resource that you can revise in the first 5 days. Just spit it out, just vomit it out towards on March 12th and secure that rank that you always dreamed of. Okay, and boost your rank and get the branch. Another example I'll give you. So see this. So heparin and warfarin, the difference has always been asked. In one small words, I'm just writing what is the... So I remember that they just saw the previous year questions that were probably given in the back of the Govindrai Garg or your these apps. Okay, so CYP2C9 they have asked from how it's metabolized. Just wrote that. So we all know warfarin is teratogenic. That can obviously be asked, but sometimes it has asked teratogenicity. What are the features of teratogenicity? So wrote down those 3 features of teratogenicity, and that's about it. Rest everything extra small 2 or 3 extra points that you feel are less than first aid. Put that down. Make this one single consolidated resource that you can revise in the last 10 days. 5 days for these, the first and the second prof, and 5 days for your final prof, and that's about it. Vomit it out, get the best rank possible, and be done with this not horrible, but yeah, be done with this, journey and this, a really tough examination called NEET PG, and get to a desired rank. So this is my strategy on how to use first aid to boost your rank. There's a link for the current first aid, which first aid you can buy in the description. You can use that. You can also watch Dr. Parth Palans. He's a junior of mine. I've been watching his videos and I'm really impressed by the quality of content that he's making. On how to utilize your 20th notebook. In my opinion, this is a 20th not a notebook. This is your 20th book, which will help you crack this entrance examination. You can watch that video if you are more comfortable with the 20th notebook concept. So thank you and have a nice day.